Hello, my name is Monica Champagne. I'm a project coordinator with the Windsor Essex Local Immigration Partnership, otherwise known as WELIP, and I'm here today to share with you some of the initiatives we have been working on in support of our temporary foreign worker communities here in Windsor, Essex. Now, engaging with the temporary foreign worker communities of Windsor, Essex is a new mandate for us at WELIP, though it's certainly not new for all the dedicated partners we have worked with so far. Our work began almost a year ago, and in that short time, we've had some very notable outcomes. And our community has come together to share with us their priorities and next steps for this work, and I'm very happy to share some of those details with you. Some of the initiative highlights that I'm here to talk about are the community conversation we held and the ensuing action plan that was developed by the community. The Workplace Wellness for Agri-Food Workers Task Force, the Hub Connect Subcommittee, the Economic and Social Impact of Temporary Foreign Workers Task Force, the Positive Messaging Campaign that we developed, and We Speak, a language access initiative that really came to the forefront this past year. Now, I'm not going to name them all, but just before we begin, I wanted to give you an idea of all the partners that we have engaged with in this work. And these partners were very excited to engage with the temporary foreign worker communities and in support of them. And the community has really come together in support of this work in the last year. This is also a good place to find the acronyms for some of the partners that I will be referring to in this presentation. On November 12, 2020, the Windsor-Essex Local Immigration Partnership, in collaboration with the Office of Windsor-Tecumseh MP Eric Kuzmerchek, and with the support of the mayors of the municipalities of Leamington and Kingsville, the Ontario Greenhouse Vegetable Growers, OGVG, Invest Windsor Essex, formerly the Windsor Essex Economic Development Corporation, Erie Shores Healthcare, Ontario Health West, formerly Erie St. Clair Local Health Integration Network, We Speak, the Migrant Worker Community Program, and the Windsor Essex Bilingual Legal Clinic and Care for International Workers held a community conversation on the economic and social impact of temporary foreign workers in Windsor, Essex. Over the course of the conversation, we heard from our local partners about all the good work that was already being done in Windsor, Essex in service of the temporary foreign workers communities. And we were lucky enough to have Luce Gélinas from Employment and Social Development Canada share with us the details of the Migrant Worker Support Network pilot project in British Columbia, and then stick around to answer some questions from the community, along with the Director for Immigration, Refugees and Citizenship Canada, Gillian Wan. Some of the highlights of this community conversation include that we had 135 unique participants, representing over 70 stakeholders and service provider organizations. The community conversation was attended by the Parliamentary Secretary to the Minister of Immigration, Refugees and Citizenship, Soraya Martinez Ferrada. There was a lot of great dialogue during this community conversation, and we used the outcome from it, along with surveys sent to participants and the steering committee meetings, to help identify community priorities. Our planning partners had the opportunity to review the draft results, and we worked together to develop an action plan and the priorities I am about to list. These weren't always easy conversations to have, but they were necessary and they were very productive ones. So the identified priorities were increase earliest access to equitable health care, safe employer-provided and private housing, healthy and safe working conditions, worker and community-informed collaborations, linguistic and cultural safety. As we discussed these priorities, it became very clear that the end goal of this work really is community integration. It was important to all the partners and continues to be important that our temporary foreign worker communities be welcome into the fold of Windsor Essex and be provided with opportunities to feel a part of the community, to feel safe and cared for, and to be able to engage with their neighbors. You can see a more detailed version of this action plan is available on our website. It goes into a little more detail about some of the ways we can continue to support these priorities. This includes the engagement work that we have done in this past year that I'm going to share with you now. One of the first engagements we undertook with the help of Sarah May Garcia from Ontario Health West, formerly the Erie St. Clair LHIN, was to reform the health table that had first come together in 2018 through the Ontario Greenhouse Vegetable Growers' 3 stakeholder engagement sessions called Building a Stronger, More Connected Kingsville-Leamington. We were lucky that these engagement sessions had already taken place, and they gave us a foundation on which to continue building for a number of our initiatives. And we certainly thank OGVG for their dedication, participation, and continued efforts in this work. Workplace Wellness for Agri-Food Workers Task Force, or WOW, is now 31 members, including representatives from the Windsor Essex County Health Unit, OGVG, the Occupational Health Clinics for Ontario Workers, OCOW, a number of regional family health teams, Windsor Essex Community Health Center, Invest Windsor Essex, Migrant Worker Community Program, Care for International Workers. We have standing monthly meetings to address any number of health and wellness related issues. Most recently, a lot of discussion around COVID testing, quarantine measures, vaccination resources, education, primary care capacity, and ways to increase primary care capacity and service limitations that might arise. Mental health programming and resources, including a partnership with the Canadian Mental Health Association's On the Front Lines project to get mental health professionals onto farms, and always sharing any current or up-to-date resources or information with each other. The goal is to not do anything twice. So it's sharing resources, sharing information with each other so that we all have it as soon as it becomes available. Some of the highlights for this task force include Ontario Health West came to this table to inform their provincial immediate and long-term seasonal worker strategy. As an already established table, we had a lot of resources to share with them and information to share with them. The Windsor Essex County Health Unit shared with this table details of their temporary foreign worker vaccine distribution and education strategy so that the partners could support the efforts of the health unit. A lot of sharing and distribution of multilingual health resources, including a COVID library. Connecting each other to share data, resources, perform outreach, and connecting the Windsor Essex County Health Unit to OGVG to help improve OGVG's Hub Connect app, which I will go into in a moment. We're very fortunate that this work garnered some very positive media attention. In particular, the task force efforts around the temporary foreign worker vaccination initiatives. From about mid-April to mid-May of 2021, the health unit was holding their temporary foreign worker vaccination clinics, and through the community efforts and partnerships, we're able to get more than 50% of workers their first dose of vaccine. And these positive news stories got the attention from the Minister of Immigration, Refugees, and Citizenship Canada, Marco Mendocino, who came to Windsor, Essex, to visit one of the farms and congratulate all the partners on the efforts that they have put in to get our temporary foreign worker communities vaccinated. We had the opportunity to sit with the minister and share with him the details of this work, thank him for his interest in spotlighting it, and discuss with him too some possible next step for continued improvement in our temporary foreign worker community engagements. So as I mentioned, one of the positive outcomes from the Workplace Wellness for Agri-Food Workers Task Force was the Hub Connect subcommittee that formed. Hub Connect is an app that workers can download. It's a network of community resources for international farm workers and newcomers that helps them navigate their new rural communities. So it's a resources for them to find things from healthcare, learn about transit, news, community engagements, etc. The Hub Connect subcommittee was 16 members, including OGVG, Ontario Health West, the Health Unit, Access Alliance, and the Occupational Health Clinic for Ontario Workers. The subcommittee was formed when the Windsor Essex County Health Unit, recognizing what a valuable tool this was for communicating with workers, offered to help the Ontario greenhouse vegetable growers really grow the app and increase the content that was on it. Really looking at strategies for increasing the uptake, adding additional languages, adding content to make it more interesting to the workers so that they'll engage with it. Some of the highlights of this committee include the health unit adding COVID resources that can stay updated, the occupational health clinics for Ontario workers and Access Alliance Health added their multilingual farm worker resources to it. It now has a COVID-19 screening tool, increased content in Spanish, welcome and how-to videos. Hub Connect is an integral part of the WOW task force and a standing agenda item for our meetings, really focusing on using this app as a way to improve outreach to international farm workers. Another ongoing engagement is the Economic and Social Impact of Temporary Foreign Workers Task Force, which was also formed as a continuation from the engagement work started by OGVG. In 2019, the original collaboration of Invest Windsor Essex, formerly the Windsor Essex Economic Development Corporation, the University of Windsor, and Workforce Windsor Essex resulted in a preliminary impact report on migrant and temporary foreign workers in our community. The current task force, which is made up of members from Workforce Windsor Essex, Invest Windsor Essex, the Migrant Worker Community Program, the City of Windsor, and Service Canada, has used these findings as a foundation to develop and expand on the many contributions that temporary foreign workers make to the community. This collaboration will result in a report for the community to read, but has currently been used to inform a positive messaging social media campaign that you can see some examples of right there. This campaign helps to reinforce the social and economic contributions that temporary foreign workers make to the local economy, to our food security, and to the fabric of our communities. As well, we've had commitments from partners to help amplify these messages. As you can see there, the Consulate of Mexico in Leamington retweeting. Temporary foreign workers are essential to Windsor, Essex, and to Canada, and it's important that their positive impacts be highlighted and shared widely. So some of the highlights of the Economic and Social Impact of Temporary Foreign Workers Task Force includes this positive messaging social media campaign. As you can see there, that first tweet with the gentleman in red, just that single tweet had 33,000 and 34,000 Twitter impressions in February and March, so just in those couple months. 4,200 impressions and 113 engagements. So we know that people are seeing these messages and interacting with these messages. This content that was developed will continue to be used and published throughout the year. And because of our partnerships, it has allowed us to translate the messages into Spanish and to Thai, and soon to be French. So you can, if you'd like to see more of this positive messaging campaign, you can follow us on Twitter at Windsor Essex Lip is our Twitter handle. And then we have the We Speak Language Initiative. The We Speak Language Initiative began years ago as a response to language barriers faced by our newcomer and immigrant communities and how those language barriers impact their access to healthcare. We Speak has now played a vital role in the support of our temporary foreign workers. As many of you know, language barriers have a major impact on both the quality and costs of support services. And research indicates that people who have limited English proficiency may be excluded from or experience delays or denials in receiving services. So in response to language barriers, health, social service, and government partners came together to develop We Speak, which is a language access initiative giving providers the ability to gain access to scheduled or on-demand professional interpretation services in person, by phone, or video. Simply put, We Speak is an app you can download on your phone or tablet to use as needed, or a phone number you can call for using over-the-phone supports. If you need language supports, you open it up, input your access code. Within seconds, you have a professionally trained interpreter available by phone or video. It's available in 175 languages, and you only pay for what you use. There are no monthly service fees or registration fees. It's just pay as you go. As you can imagine, WeSpeak became invaluable once COVID hit. As COVID started to affect the temporary foreign worker communities and on-site testing began to mobilize, the ability to communicate in first language, and not just Spanish, but also in Thai, Tagalog, Haitian Creole, became paramount to both agri-food workers and to the healthcare workers who were all trying to manage under a very stressful situation. And from July to the end of March 2021, WeSpeak was used for over 15,000 minutes of interpretation just for COVID response alone. Over 50,000 minutes in Windsor, Essex by the end of March 2021. Windsor, Essex used over 50 languages. So some of the highlights from the WeSpeak language initiative include securing the domain name, www.wespeak.ca, where you can go to find up-to-date information about these services. We released a press release in March 2020 and got some recognition and some media engagement. Our WeLip chair, Hugo Vega from the YMCA of Southwestern Ontario, was interviewed on AM 800. We distributed 200 promotional packages to primary care providers in Windsor, Essex, and currently have over 25 providers registered throughout Southwestern Ontario, and it is growing daily. One of our proudest highlights of the WeSpeak Language Initiative has been its use at the vaccination clinics, the Isolation and Recovery Center, and by EMS's Community Response and Stabilization Team. All of this engagement in the past year has given us the opportunity to have conversations with various ministers, including, again, the Minister of Immigration, Refugees and Citizenship Canada, Marco Mendicino, and the Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough. And it's the opportunity to share with them the work that our community has undertaken both pre-COVID and as a result of COVID, and really to express our readiness to engage full steam ahead in the work that still needs doing. And along the way, we have had mentions in the media of the nature of this work and the positive outcomes that are resulting from it. So what are the next steps? One is to continue with these stakeholder engagements, using the action plan developed in the previous year to inform the strategies that we engage in going forward. Another is the continued economic and social impact of temporary foreign workers task force, where we will use the data and information collected while constructing the positive messaging campaign to inform a report for distribution. We are engaging with the University of Windsor on a temporary foreign worker research collaboration called Get to Know Your Neighbors, where they will conduct virtual interviews with workers to find out more about them. What brought them to Canada? What do they do while they're here? What services do they access? Just to get to know our worker neighbors a little bit better. We have started a WeLip Facebook page. The handle is @WindsorEssexLip, just like our Twitter. Please go to it, like us, follow us. While engaging in this work, we noticed that there were a number of partners that were very active on Facebook, but not necessarily on other platforms. So we started our own Facebook so that we could engage with them better and to share best practices with the other Southwestern Ontario LIPs, as I am doing right now. So those are some of the highlights of this work. I thank you so much for listening and allowing me to share. You can find out more information on our website, as well as through our social media on Twitter and Facebook. Please follow us, like, and share this information. It's important to get it out across the community. And those platforms are where we will continue to update this work as we progress through it. Thank you for your time.